Today we have visitors in labor. Okay, visitors in labor. I feel pretty strongly about this topic. Visitors can kind of go two ways. They can be awesome supporting people, or they can be a detriment to labor. So, first of all, what I'm talking about here, visitors in labor, is inviting people into your labor. So, sometimes people might want to invite a friend to labor with them. A grandmother is usually a grandmother to be. So the birthing woman's mom might want to join labor. Friend, cousin, any of those type of people who have expressed interest, or you're interested in inviting someone into your labor. So the first step, number one, I think, is that you really, as a couple, need to discuss who should be invited into the labor and make sure that you're on the same page about it. So partners, make sure that this conversation is one that you have way in advance. And if both of you agree not to have anyone in labor, that should definitely be honored by anyone who's expressed interest in labor. Because this is such an important time, and having unwanted visitors is not a good idea. And we're going to cover what might happen after that. But number one, please have a conversation about it. It's so important to get on the same page on who you want there. And really, number two, whoever you do decide to have there, have a role for them, whether they are someone who is going to, be your errand person, where they run out and fetch food or fetch water, fill up water bottles, get snacks, relieve your partner, relieve whoever is the main support person, help out your doula. What is their role? Why are they there? Are they there to take pictures? Are they there just to experience it and be sort of on the sidelines, not interacting at all? What will their role be? Next thing is, how much time will they be there? Are they going to be there the entire time? Will they only join during active labor? Will they only come in at the very end, right before the baby is born? So if you have someone who you want to be there at the actual birth, they can sit in the lobby up until nearing the end of pushing and then have them come in. They don't really need to be there the whole time if that is not your desire for them. So who's going to be there? Make sure you're on the same page. What their role is going to be, and then make sure that they know what their role is going to be, so that they can feel like they have a purpose and they know what to do. The second thing, or another thing that you should make sure your visitors know, is what your preferences are for labor. So I've got a great example for you. I had a client that I worked with that she really wanted an unmedicated birth. So she was planning on using lots of different coping techniques. She was hoping to avoid an epidural, and she invited her mother to join her in labor. Well, she was afraid, these are her words. She said, "I'm afraid to tell my mom what kind of birth I want because I don't want her to judge me." Well, this was not a good idea, because when the grandmother-to-be, her mom, joined labor and saw that she was, having to really work through contractions, she wanted to avoid the epidural, her mom was shocked and very unsupportive. Definitely was the whole time trying to convince this woman to change her mind about the way she wanted labor, was just grumpy. And does anybody want that kind of energy in the room when you're birthing? No. So you have to prepare the visitors for what they're going to see, what they're going to experience, what kind of birth is really is what's important to you. They should not be totally shocked by your choices in labor. They should be supportive of them. I would also make a talk with your partner about maybe either a code word or a way for you to alert, a way for either of you to alert each other that the visitor needs to go. So that's something the partner can do, can kick a visitor out. So I've seen a code word used, like if I talk about wanting a banana, that means I need you to ask my mom to step out of the room for a while to take a break. So make sure that partners are ready to have those conversations about, hey, can you give us some time alone, or we really need to rest and we'll come get you from the lobby, or can you run home and check on the dog, or whatever. Something to give you a break from visitors if you need them. And the main thing that is, kind of why I'm setting this up, to be really clear with your visitors on their role and what they're there for, and that they're on the same page, is because if you don't feel supported in labor, your labor can actually stop. It is wild, and I've seen it before. I have seen someone in labor, laboring right along, 5-minute apart contractions, minute long, nice strong contractions, and in walks a family member that they didn't want there. And all of a sudden you see the contractions go from 5 minutes apart to 8 minutes apart to 10 minutes apart to 20 minutes apart to stopping. Labor actually stopped. And then when we asked the family member to leave, sent them on an errand, about half an hour later, labor picks back up again. It's amazing how your body can have that reaction to feeling unsupported and uncomfortable in your birthing space. So really think about this when you are planning your visitors, because the last thing you want is someone to slow down labor, right? So consider your visitors very carefully. Now, I think I have seen some amazing visitors in labor. I've seen grandmothers to be total rocks. I have seen sisters step up and be amazing helpers in labor and be that face on the side of the room that always is happy and positive and encouraging. And make sure your visitors know, hey, watch your facial expressions, because if it's a little bit scary or disapproving, I'm going to see it, and I need your full support. So let them know that it's almost like you're running a race, you're running a marathon, and they're going to be your supporters. So no matter how you look, if you're running and you're on mile 25, you're not going to look great probably. And you're going to look tired, but just say, you're doing it. Good job. Keep going. I have some more links or information on visitors in labor. I have a download about quiz. It's humorous, but it's real, that I will put in the comments on YouTube. And just some more information about verbal support in labor that you can pass on to whoever is going to be a visitor if you choose visitors in labor. So just to recap, choose your visitors wisely. Have that conversation with each other as a birthing team on who is really welcome in labor, if anyone, and what their role is going to be, and then meet with them, let them know their role. Make sure partners know how to kick someone out if that time comes that needs to happen. And certainly take a look and make sure that you have only supportive people in labor, because it makes a difference. Unsupportive people can slow it down and stop labor. And that's the last thing we need. Oh, okay. Today we have midwives. Midwives are care providers. So midwives are trained professionals. So there's a couple of types of midwives. We have the traditional hospital setting midwives, and they have a nursing degree and a master's in midwifery. And they can take care of women for the full spectrum of health for OBGYN health. And so they can do well woman care, they can do deliveries. And the only thing that midwives don't do that is a little different from an OB is work with high-risk patients and do surgeries on their own. But other than that, midwives can do so much. And working with a midwife it can be a little bit different than working with a classic OB doctor. A lot of times we see midwives follow a different philosophy of birth, that they really view birth as a normal occurrence and not pregnancy and birth as a sickness that needs to be treated. So a lot of times we see kind of a difference in philosophies between midwives and OBs. This is a generalization, so it's not every single midwife, every single OB, but in general, midwives tend to have a philosophy that birth is a normal, natural, physiologic process and tend to honor those physiologic birthing principles. Sometimes I have talked to people that say, well, if my insurance will pay for a doctor, why would I have a midwife? Which is a really great question. Midwives have a different type of care. Like I mentioned, their philosophy of birth. Sometimes you see that they practice a little differently as far as testing goes, as far as number of hours with patients, but their skill level and care is very much the same as far as you would be very well taken care of if you went to a midwife as opposed to an OB. I really encourage people when they start their pregnancy journey to do some interviews. Don't necessarily go to the care provider, the midwife or the doctor that you've always been to. It's good to kind of talk to them about their ideas about labor and birth, find out about the hospital that you're birthing at. And at that point, if you haven't interviewed midwives before, definitely I would consider interviewing them so you can get a feel of how they're different. So those were hospital-based midwives. There are a couple of other types of midwives I'm just going to touch on. Certified professional midwives. So those are midwives trained in an apprenticeship model, and they generally practice either at a birth center or at a home birth settings. So those are CPMs. And then there's lay midwives who follow more of an apprenticeship training as well. And they have different professional standards. I'll try to put some links below just for more information. So midwives are amazing. I have worked with many great midwives in my career. And I think that if you have especially a low risk pregnancy, I would really consider talking to some midwives and see what you think about the difference in philosophy. Today I have birth plans. Birth plans. So a birth plan is a document that a couple puts together about their preferences for labor and birth and their newborn. They bring it to the hospital or their birth center, wherever they're giving birth, or give it to their home birth midwife, and it lays out their top priorities and their preferences for birth. Now, a couple of thoughts about birth plans. First of all, in recent years, I have heard them sometimes get a bad reputation. There's this really pitiful joke about the longer your birth plan, the more likely you're going to have a cesarean, which is just so disappointing. That being said, however, I, as a doula and a childbirth educator, I encourage my clients to do a one-page birth plan if possible, so that really their preferences aren't diluted by things that maybe aren't as important. So things that you would put on your birth plan include your preferences for how you're planning to cope through labor contractions. Are you planning to use movement, avoid pain medication? Are you hoping for an epidural, and at what time is your epidural preference? You might have preferences about who's in the room. You might have some health history that you'd like to include on your birth plan. Maybe you want to include any kind of allergies, any information that the nurses, the midwives, and the doctors, all of your care providers working with you for your birth, that they could provide a better care for you if they knew this information. So, any little detail, if you've experienced any kind of trauma in your past, especially any type of sexual trauma you might put on your birth plan, most of these things are not something that you should introduce on your birth plan, that you should have conversations with your care providers prior, so that they're familiar with all your preferences. So try to get a one-page together that has all of your really top information on your preferences, including, I like to add the end section for preferences for baby. So do you have any specifics for the newborn care procedures, for bathing, all of those skin to skin and that type of thing? Now, if there's hospital policies that you know that they always do, so say they always do a skin to skin first hour with the baby, maybe you don't add that on your birth plan. If you're trying to keep it to one page and you need to take something out, you don't necessarily need to put hospital policies that are just routine, because those are routine. So really limit it to those really specific things. So once you put something together, make sure that you share it with your care providers in plenty of time in advance. Your 30-week appointment, you're somewhere in that time frame, so that if there's any concerns on there, so say one of your preferences is you want to give birth in the water, and you don't talk this over or bring the birth plan to your care provider's office and discuss it with them, and you get into labor and they say, oh, sorry, you didn't qualify, you're not able to give birth in the water, or we don't offer it at this hospital, or we stopped doing water birth. You really need to have those conversations ahead of time. And if you're in a practice with several different care providers, which most people are, I would suggest that you bring it to every appointment that you can, as far as, talking it through with each. Or if they put it in your healthcare file, just making sure, just asking like, hey, did you see my birth plan? Was there anything that we should discuss ahead of time that might seem like a challenge and or might not seem doable? So sometimes people don't like to call it a plan if they feel like it's too rigid. You can always call it your birth preferences. But a lot of times when we get to our birthing location, our care providers, our nurses will say, did you bring your birth plan? It's because they like to look it over. And if there's a shift change, it's a nice way to share information among the nurses and the providers. So birth plans can be a great way to communicate your desires for birth with your team so that they can provide the best care for you, in particular, individualized care. So I recommend them, and I recommend a one page. And at the minimum, even if you don't feel comfortable for some reason sharing it with your providers, it's a great activity. It's a great thing to go through with your partner and make sure that you guys are on the same page for your birth plan. So for your birth and your preferences. So signs of labor. Ooh, good one. Here. Signs of labor. This is a great question, and I get a lot in childbirth class, is how will I know if I'm actually in labor, right? Especially if it's your first time. You've never been through labor before. You don't know exactly how it feels. And certainly TV and movies do not get it right. They show a lot of screaming, they show a lot of grabbing, and real dramatic, because obviously it's supposed to entertain us, so it's going to be dramatic. But the start of labor for most people, especially the first time you've given birth, can be a lot more subtle. And if you go to a childbirth class, if you read about contractions, you'll probably see them drawn kind of like this, like a hill, like a, with that peak and the ends kind of trailing off. That is certainly what it feels like, where your uterus just contracts and it gets stronger and stronger and stronger, and then it gets lighter and lighter and lighter. So it kind of peaks like that. And a uterus that's contracting is certainly a sign of labor. But the beginning of labor your uterus can often feel more like a menstrual cramp. other people have described it like a gas pain. And so it might not have that real peaking look or feel to it. It might just feel kind of like, oh, I'm a little bit off, a little bit crampy. Usually you will feel the beginning contractions below your belly button when they are actual uterine contractions of labor. Sometimes people feel them in their back more, but they're different from Braxton Hicks in that they don't usually feel like your whole uterus is tightening. They usually feel underneath. So a sign of labor could be, one of them is your uterus contracting, which causes a crampy feeling, which causes maybe even a gassy, pressury, crampy feeling. And sometimes it has a start and a stop, and sometimes it's just kind of a vague feeling that you can't really define the edges, the starts and the stops. So that's certainly a sign of that labor is starting. The second one, which is a topic that we discussed at the very first wheel spin, which has to do with poop, your bowel movements. Often an early sign of labor is having to increased bowel movements or softer bowel movements. So not to the point of necessarily diarrhea, but some, more quantity and softer. It generally is a sign that labor is starting. Sometimes people lose their mucus plug, which is also a topic that we have discussed, and I'll put links in the YouTube description below. And the mucus plug, when the cervix dilates, the mucus plug can come out, and that is a plug of mucus that is kind of like keeps bacteria from getting to the baby. And when the cervix dilates, the mucus kind of drops out, and sometimes it's all at once or sometimes it's little bits. So as you go to the bathroom and wipe, you might notice an increased amount of mucus, and stringy mucus, sometimes brownish because it might have some blood that's older, or sometimes pinkish or reddish. So that's a sign of labor. Another sign of labor might be your water breaking, which has also been a topic we covered on the wheel, and that can happen at the beginning of labor or before labor starts. Rupture of your membranes is the technical term, and that is when you notice fluid leaking out. That doesn't really stop. It starts and stops, but it doesn't stop completely, which would be your water breaking. Other signs of labor, which aren't like super, don't necessarily have to do with your anatomy. A lot of people notice that they feel that nesting urge where they want to clean things or organize things. That's not a scientific sign of labor, but I would say a lot of people have expressed that they experience that before labor starts. Other things that, that start labor, or that might be a sign of labor, or one other thing that can sort of sometimes indicate that labor is on the way is when the baby's head engages in your pelvis. So that is when the baby's head drops into the pelvis. And the way you might know that this has happened is if you have experienced a lot of like feet and kicks and things up in your ribs, and kind of a shortness of breath where you feel like the baby is high, and then all of a sudden your belly feels different shape. The baby feels lower, you can breathe a little bit easier. That could mean that the baby's head has engaged in your pelvis. And sometimes you might hear this called the baby dropping. So I remember going to a grocery store when I was pregnant, and one of the clerks saying, "Oh, you're going to have the baby soon. Looks like that baby dropped," which I thought was so funny because how do they have any idea that my baby has dropped or not? Sure enough, it was like 2 weeks later that I had the baby, but sometimes people like to give their anecdotal information. So baby dropping into the pelvis sometimes can indicate that labor is on its way. However, babies can also kind of move back and forth, so it's not necessarily a definite sign of labor. But water breaking, mucus plug, loose stools, loose bowel movements, and contractions. Contractions is really our real surefire, okay, something's going on and it might lead to labor, or it could be the beginning signs of labor that might happen in days. So, okay, today we're talking about lights in labor. Lights in labor. Well, let's think about it. Lighting. Right now I have lots of lighting on, right? So that have a nice video and see really clearly. However, in labor, most people in labor want the exact opposite. So the good news is that wherever you will be giving birth, whether that be a hospital, a birth center, or your home, you should have control of your lighting. And I'm really gonna talk to the partners on this one. Your support team, partners, if you're watching, you are almost like the set designer in a movie or something like that, trying to make sure that space is super comfortable, relaxing, and a setting that she can be super comfortable laboring in. So if you can imagine, those bright lights, bright fluorescent lights, probably are not going to be what is most comfortable in labor. Usually a low lighting, maybe more natural light. If there's a window, that's certainly more appealing than artificial lights. So partners, you can really, as you get settled into your birth location, look around. What lights can you turn on? What lights can you add? I mentioned in an earlier video about the bathroom, when we talked about the bathroom. Lighting and bathroom, the lighting in the bathroom is, to me, really important. So if you haven't checked that out, I'll put a link below and a link here for the bathroom video. But a lot of times in our hospitals, especially, the lighting is like super harsh. It's almost like a interrogation or something. So I really recommend in your bags to have little battery operated candles or little holiday Christmas lights to hang in your bathroom, in the bathroom of the hospital or the birth center, and really have a nice feel in there. So partners, this is a great thing, especially as you get settled into your location, and maybe there's a lot of paperwork going on that you're not needed for, or getting an IV set, something like that. You can really set up that scene, and one of the big things is lighting. The other thing with lighting that I found helpful is that if you are experiencing a super long labor, so you come in, nighttime happens, and then the next day starts, sometimes it is good to change the lighting at that time, just to kind of refresh and restart and feel awake and feel like it's morning. Now, this certainly isn't how the preference of everyone, but I have felt that if you need that pick-me-up and you have the ability to take a shower or change your clothes that you're laboring in, change your gown, if you're choosing to wear the hospital gown, and turning on some lights, it can really kind of trick your brain into feeling like, oh, okay, I'm awake, I have energy. And what I've seen is you can kind of have that reset with the lighting and up the lighting till you have a nice, more energized mood. And then if you want to start lowering the lighting down to a more comfortable level at that time, then that can work as well. So don't forget about the lighting in labor. Again, partners, you're really, one of your main abilities is to help set the scene for labor. Sometimes our care providers are going to need some extra lights, so putting in an IV or doing an epidural, doing any kind of procedure, maybe even charting on the computer, they might need to add some lights. But certainly you can ask them, hey, can we have low light? Can I turn this off when you're done? And the other thing I want to mention with lighting that I find happens at birth is sometimes some providers use kind of a spotlight basically a spotlight right on your crotch. So as baby is emerging, so they can have a good view of baby emerging. And so there are some lights that they can kind of direct right to our emerging baby. And sometimes what I've noticed is even after, like, if there is a repair, if you have a tear, they'll add the lighting. But sometimes people forget to turn that light off. So you're holding your new baby and you're trying to get comfortable in your bed, and you still have this kind of spotlight going on. So just be aware and ask, if you can turn that off, or partners can ask that too. So that is a light that you might not be aware of is not usually, but can be turned on by care providers if they need a little bit of extra light. So lighting in labor can help set a mood. It can help set a relaxed mood. It can help wake you up if you need that waking up in a long labor. And then just the bathroom. Make sure that you have some kind of lighting alternative in the bathroom, and you will really be glad about it when it feels more like a nice peaceful cave than like you're being interrogated by the police. So lighting in labor is important.